Hello, I'm Bobby Woodard. I'm a pharmacist at Westview Medical Center, and this is my cohort,
Samuel Osei.
Okay, I have some questions. How do different diabetes medications work in the body for people with type 2 diabetes?
Okay, we're going to talk about two popular drugs that are used right now, the two most popular ones, one being metformin and one being glipizide. Mr. Osei, Sam's going to take metformin, and when he finishes up, I'll talk about glipizide a little bit, okay?
Metformin is a drug used in type 2 diabetes. It's either used alone or in conjunction with other medications. Metformin helps lower your blood sugar in 3 different ways. The first one being instructing the liver to make less glucose. The second one being it lowers your insulin resistance by making your muscles use insulin better so that the glucose stays out of the blood and inside the muscles. Third one, it helps your intestines absorb less glucose from your food that you eat. The dosing of metformin is simple. There are 2 formulations, the immediate release formulation and the extended release formulation. The immediate release is dosed at 500 to 1,000 milligrams twice a day. And the extended release formulation is dosed at 500 to 1,000 milligrams once a day. These doses can be adjusted depending on your situation by your physician. Common side effects of metformin include bloating, gas, diarrhea, upset stomach, and loss of appetite.
That was an overview of metformin, and now I'll talk about glipizide just a little bit. Glipizide is an oral medication used to treat type 2 diabetes. It comes in tablet form. It comes in 3 different strengths. It comes in 2.5, 5, and 10 milligrams. Glipizide should be given 30 minutes before you eat each day. If you're taking it once a day, you take it 30 minutes before breakfast. And if you're taking it more than once a day, you take it second dose 30 minutes before you eat dinner. As I said, it comes in 2.5, 5, and 10 milligram tablets. Your doctor and your physician will most likely start you on the 2.5 milligram tablet initially, and after 3 weeks to a month, you'll go back to your physician, and if your blood sugar isn't lowered quite right, or if your A1C isn't right like what your doctor wants it to be, he may raise it to 5 milligrams, and then he'll repeat the same procedure again. He'll wait 3 weeks to a month and repeat blood sugars and A1Cs again to make sure that you're actually under control. And if not, he may raise it to 10 milligrams. Glipizide shouldn't be given, if you're giving more than 40 milligrams per day, it should be given in split doses, with the first dose being before breakfast and the second dose being before dinner. Again, it's an oral tablet. It shouldn't be chewed or crushed before you use it. You should swallow it whole, okay? And the same side effects as with metformin you have with glipizide. You have a little bloating, you have diarrhea, gastrointestinal problems, and sometimes if you take too much of it, you can have what they call hypoglycemia, which is low blood sugar, which can cause you to sweat a little bit and have you be a little bit nervous and things like that. Okay?
Can some people take more than one type of diabetes pill, or they could take like both of the ones that you mentioned for the same person the same day?
As we just mentioned, metformin works in one way to lower your blood sugar, and glipizide works in a different way to lower your blood sugar. So actually, you can take those 2 medications to actually together to lower your blood sugar. Metformin works to reduce the amount of glucose in your system, and the way glipizide actually works, it works on your pancreas. Your pancreas is the organ inside your body that actually produces insulin. So glipizide actually makes your pancreas produce more insulin, where you get a better response to your diabetic program. And metformin and glipizide both work in conjunction with diet and exercise. So all those together lowers your blood sugar and helps out with your 1AC.
Okay, I have a lot of people that come to me in my office. I'm a diabetes educator, and they want to know about their medications, but it seems like a lot of people don't realize that they can come to a pharmacist. So can they come to you guys, to a pharmacist, to talk about a medication that their doctor has ordered?
Yeah. Now, lots of times when you go to your physician's office, your doctor will place you on a medication, and the doctor will probably go over it with you while you're in the office, but the doctor is sometimes talking a little fast, and you may not understand all the things that the doctor is actually saying to you. So once you get to your pharmacy or your pharmacist, get a chance to talk to your pharmacist, by all means, ask your pharmacist more questions to be more specific with you and let you know exactly what you're taking and how you're taking it and what's it for. So by all means, always ask your pharmacist.
Okay, some of the medications for diabetes can get a little expensive. I think it depends on different people's insurance plans. So do you have any suggestions on how to reduce the cost of some of the diabetes medications?
Cost reduction has been a big problem in diabetes therapy. There are certain medications, especially the newer ones, that are very expensive, and if you have no insurance, it becomes a basis of non-compliance with the therapy. Common ways to reduce your cost, of course, is to keep exercising, keep your body active so you don't get to where you need a medication. Secondly, you maintain a healthy diet. Diet plays a very big role in diabetes management. You don't get up in the morning or in the afternoon and eat a lot of candy or sweets. You have to manage those and consume them in just little bits, and spread your diet around where you eat anywhere from 3 to 6 times a day, little at a time, okay, to prevent you from needing that medication. Because the more you go off your diet and go into just a regular diet, the more likely you are to need the medication. And thirdly, utilizing generic medications. Lots of these medications come in generics, and sometimes patients come to the pharmacy and say, I don't want the generic, I want the name brand. Only to realize that the generic would cost maybe $10 or $12, and the name brand maybe $500. So there needs to be some education on the part of the health professionals on generic utilization. The generics was just as good as the name brand. And most of the time, the company that does the generics is the owner of the name brand company. So basically, they're utilizing the same medication under a generic name as opposed to a name brand medication. And of course, the other one is through insurance and discount programs.
Yeah. And as Sam just said, metformin and glipizide are both first-generation drugs used to treat diabetes, and they're both in generic form right now. And they're two of the least expensive drugs you can actually buy at your pharmacy. So I always ask your doctor, is there anything cheaper that I can actually use to control my diabetes? So like I said, glipizide and metformin are both available generically right now. Our pharmacy at Westview, we offered a $4 discount program where you can get a month's supply for $4 of either one of those medications. So of course, we're always there to help you with the cost of your medications.
Right. And how important is it for people to take their diabetes medications and to take them at the times that needed?
It's very important you take your medications exactly as prescribed by your physician. As I mentioned earlier, that glipizide should be taken 30 minutes before you actually eat. That helps it work a whole lot better. And if you don't take your diabetes medication as prescribed, your diabetes can continue to escalate out of control. So it's always best to take your medication daily as prescribed by your physician. Okay?
All right. Well, I want to thank you guys, Bobby and Sam, both for talking to me so that we can help the people that are doing the FreshRx program and they can know a little bit more about their medications. Anything else you guys want to add?
And if you have any questions about your medications, you're always free to call Westview Pharmacy. Ask for Sam, ask for Bobby, and we'll gladly tell you anything about your medications. We're always here to help.
Thank you, guys.
Thank you.